Prevention is better than cure. Hope you all are safe at home. I am N. Maheshwari, Assistant Professor, Department of History, Sri Sarda College for Women, Salem. Of late, we have been hearing a lot about COVID-19, its effects and preventions. In this regard, let us have a look at the pandemic over the years in a historical perspective. What is pandemic? World Health Organization addresses pandemic as worldwide spread of a disease. There were many pandemics and epidemics that affected the people all around the world. And let's know some of them. Number 1. Prehistoric pandemic circa in 3000 BC. This disease spread from a village in northeastern China. It affected all the age group of people. Bodies of the dead were burnt in huge masses. After so many years, the burnt place was found by archaeological research. The place of research was named as Hamanmanga. Number 2. Plague of Athens in 430 BC. The disease broke out during the war between Athens and Sparta. The disease caused sudden violent heats in the head, redness of eyes, irritation in the throat, and vomiting stains of blood. What exactly this epidemic was has been a source of debate among the scientists. A number of diseases have been put forward as possibilities, including typhoid fever and Ebola. Many scholars believe that overcrowding caused by the war made the situation worse. The next one is Antonine plague in 165 AD. Antonine plague belongs to a smallpox virus. Many historians believed that this epidemic was brought into Roman Empire by the soldiers returning home after a war against Parthia. This epidemic contributed to the end of Roman peace. And the next one is plague of CYPRIYAN in the AD 250. This virus is named after Saint Cyprian, a bishop of Carthage, who described the epidemic as signaling the end of the world. This plague of Cyprian is estimated to have killed nearly 5,000 people a day in Rome alone. In 2014, archaeologists in Luxor found a mass burial of site of plague victims. Their bodies were covered with a thick layer of lime. Next, plague of Justinian in 541 AD. The Byzantine Empire was severely affected by this plague, which marked the start of its decline. The plague reoccurred periodically. Some estimates suggest that up to 10% of the world's population died due to this plague. Emperor Justinian also got sick with the plague and survived. However, his empire gradually lost territory in the time after plague struck. The Black Death in the year 1346. The Black Death traveled from Asia to Europe. Historians believed that the medieval Black Plague wiped out over half of European population. It was caused by a strain of bacterium, Yersinia pest, that is likely extinct today. It was spread by infected rodents to humans. The bodies of victims were buried in mass grave. The next one is COCOLIZTLI epidemic in the year 1545. This infection was a form of viral hemorrhagic fever that killed 15 million inhabitants of Mexico and Central America. Among the already weakened population by the extreme drought, the disease proved to be utterly catastrophic. A recent study that examined DNA from the skeletons of the victims found that they were infected with the subspecies of Salmonella. The next one is Philadelphia yellow fever epidemic in the year 1793. Yellow fever seized Philadelphia. The disease was carried and transmitted by mosquitoes. It experienced a population boom of mosquitoes during the hot and humid summer in Philadelphia that year. Winter arrived and the mosquitoes died, and that the epidemic finally stopped. By then, more than 5,000 people had died. The next comes flu pandemic in the year 1889. In the modern industrial age, new transport links made it easier for influenza virus to spread. In just few months, the disease spanned the globe, killing 1 million people. It took just 5 weeks for the epidemic to reach peak mortality. The earliest cases were reported in Russia. The virus spread rapidly throughout St. Petersburg and quickly made its way throughout Europe and the rest of the world. The next comes American polio epidemic in the year 1916. A polio epidemic that started in New York City caused 27,000 cases and 6,000 deaths in the United States. The disease mainly affected children and sometimes leaves survivors with permanent disabilities. Polio epidemics persisted in the United States until the Salk vaccine was developed in the year 1954. As the vaccine became widely available, cases in the United States declined. Worldwide vaccination efforts have greatly reduced the disease, although it is not yet completely eradicated. And this picture is Franklin D. Roosevelt Memorial in Washington. He was diagnosed with polio in 1921 at the age of 39. And the next on the list is Spanish flu in the year 1918. An estimate of 500 million people from South Seas to the North Pole fell victim to the Spanish flu. 1/5 of the population died. Some indigenous communities were pushed to the neck of extinction. The flu spread and the death was enhanced by the cramped conditions of the soldiers and poor wartime nutrition during the First World War. Despite the name Spanish flu, the disease likely did not start in Spain. Spain was a neutral nation during the war and did not enforce strict censorship of its press, which could therefore freely publish early accounts of the illness. As a result, people falsely believed the illness was specific to Spain and the name Spanish flu stuck. The next one is AIDS pandemic and epidemic in the year 1981. AIDS has claimed almost 35 million lives since it was first identified. HIV, which is the virus that causes AIDS, likely developed from a chimpanzee-infected virus that transferred to humans in West Africa. The virus made its way around the world and AIDS was a pandemic by the late 20th century. And December 1st of every day is observed as AIDS Awareness Day. The next one, H1N1 swine flu pandemic in the year 2009. The 2009 swine flu pandemic was caused by a new strain of H1N1 that originated from Mexico in 2009 before spreading to the rest of the world. In 1 year, the virus infected as many as 1.4 billion people across the globe and killed between 1,51,700 and 5,75,400 people, according to CDC, the Center for Disease Control and Prevention. The 2009 flu pandemic primarily affected children and young adults, and 80% of the deaths were in people younger than 65 years. A vaccine for N1H1 virus that caused the swine flu is now included in the animal flu vaccine. And the next comes Ebola virus in the year 2014. Ebola spread across West Africa between 2014 and 2016 with 28,600 reported cases and 11,325 deaths. The first case to be reported was in Geneva in December 2013. Then the disease quickly started to spread. Bulk of cases and deaths occurred all around. The CDC says the virus may have originated from bats. Finally, the vaccine for Ebola was approved on December 2019. COVID-19. And today, the world is suffering from a deadly pandemic which has taken the lives of lakhs of people and still uncounting. The World Health Organization declared this virus as a pandemic and gave the name nCoV-19, that is Novel Coronavirus Disease 2019. This virus spread through air droplets from infected persons. People infected with the COVID-19 virus will experience mild to moderate respiratory illness. People above 60 years, when infected, have serious disease outcomes. Preventive measures to protect ourselves from coronavirus. Wash your hands for minimum 20 seconds. Use mask to cover your nose and mouth. Maintain social distancing of 3 feet. As a responsible citizen, it is our prime duty to abide to the rules and regulations of the government and help the nation to win the battle against the COVID-19. So, I request all my fellow beings to stay home and save lives. Thank you.